Welcome to our second episode. I'm your host, Quincy with Frontier Nursing University. This podcast is a community health initiative brought to you by Frontier Nursing University and the Woodford County Chamber of Commerce to improve community health and increase healthcare awareness. In today's episode, we are going to talk about perinatal mental health disorders. According to the Maternal Mental Health Leadership Alliance, maternal mental health conditions are the most common complications of pregnancy and birth, affecting over 800,000 families each year in the U.S. Suicide and overdose are leading causes of death for women in the first year following pregnancy, and most women impacted remain untreated, increasing the risk of long-term impacts. Maternal mental health conditions, as we will learn today, go way beyond postpartum depression. Maternal mental health conditions can occur during pregnancy and up to 1 year following pregnancy and include depression, anxiety disorders, OCD, PTSD, bipolar illness, psychosis, and substance use disorders. Joining me today is certified nurse midwife and Frontier faculty member, Dr. Angie Chisholm. Angie has been a midwife since 2009, originally from Kentucky. Thank you so much for joining me. And tell me a little bit about your background and why you wanted to be a midwife.
Well, thanks for asking, and thanks for inviting me here to be a part of this important podcast episode. Like I said, I am from Kentucky, and growing up, I noticed some things that affected families that were dear to me, things like mood disorders and child abuse and other traumas that I wanted to impact in my career. And so when I first went to school, I studied social work, and I was on the path to becoming a family mental health therapist. But as I was doing that, I learned about pregnancy and birth, and I found out about midwifery. And once you feel the call to be a midwife, you really can't deny it. But I noticed that pregnancy seemed to be a sensitive time, that if you could impact the trajectory of that family during pregnancy, you could potentially have a big impact on preventing further traumas down the road. And so that's what inspired me to become a midwife. And I think that's why this topic is so important to me, because I do feel like it sometimes goes unnoticed, undiagnosed, and people are not getting the help that they need.
Well, that's a fascinating background, and I feel like it makes you perfect for this topic. So starting off, perinatal mental health disorders, what are they and who is affected by them?
Well, a lot more people than you would imagine. And there is quite a range of symptoms. And so we'll just go through the different categories. And this is an exhaustive list, but some of the most common things that we see out there clinically. So the first one, the first category is just something called baby blues. And I will just say that women are wired to experience baby blues, and most women do experience it. I always think about if you grew up around like farm animals or even just like a mama cat, and you tried to go up and grab one of her kittens, like she is going to be like, you know? So that is the way that women are wired when they have a baby. They will become more hypervigilant temporarily. They will feel more anxiety and more worry. And that typically lasts like the first 2 weeks after they have a baby. And we generally see that resolve around that time. And when you get into that few weeks after that, and people are still feeling that anxious and that worried, then there could be something wrong. So I will just say, baby blues is pretty common. A lot of women experience it. It's normal. And when we recognize it as normal, we can maybe not take it so personally. I feel like sometimes, you know, like mother-in-laws or spouses may feel like, oh, she's attacking me because I didn't fold the blanket right or something like that. And they feel really hurt by that overreaction that she might have experienced. But it truly is a normal behavior and something that we expect.
Right. And I think keyword there, temporary for baby blues, which I think is something, I feel like that's something we all hear about is the baby blues. But what is that? And like, what's normal, especially for new moms and the partners? Like, is this, beyond 2 weeks, is this still baby blues or is this something more? So
typically, if it's not resolving after that 2-week period, because the hormonal shifts involved in being early postpartum are what contribute to baby blues. And if it's not resolving around that time, then there's probably something more going on.
Yeah.
And the other thing that I want to just say, some of the misunderstandings that we have about, we call it perinatal mood disorders, because we often think about these things as happening postpartum, and baby blues is one of those things that does happen postpartum. But women can experience depression or anxiety all throughout their pregnancy as well. And so it's not concentrated simply in that postpartum period.
Right. Okay. So then kind of speaking to that, do you have to have a pre-existing mental health disorder to have a perinatal mental health disorder?
No.
No.
And I think that is a big misunderstanding, that sometimes people feel like that they've never had depression or anxiety before, and maybe they are very happy about being pregnant, and so then their mood changes and they're not sure, what's going on. And I do feel like clinically what I see is that a lot of people who are experiencing anxiety or depression in pregnancy especially don't recognize it until they they better. Okay, once they start feeling better, then they're like, oh yeah, I think
there's something wrong. I think
go through a depression phase. But there are a lot of things that can contribute outside of that past history. So past medical history of a mood disorder is a common, thing that can contribute to developing a mood disorder. But other things like a history of trauma, a recognition, sometimes you don't notice it until you are pregnant, but a recognition that you don't have the support that you need for a healthy pregnancy or healthy early parenting. And so sometimes having a difficult birth or a traumatic birth experience can contribute to a mood disorder. So there's a lot of factors that don't have anything to do with your past medical history of those disorders that contribute.
Okay. And so we kind of talked on the baby blues, but what beyond that,
let's talk about the other categories. Right. So the other two common things that come up are depression and anxiety. And often people think more about depression, especially during the postpartum period. But I will tell you that what I see more often clinically is anxiety. And anxiety can look like a lot of things. Most of the time when I'm talking to family members, spouses, or other people who are involved in supporting that mom, a lot of what they say is, she's irritable, she's not sleeping, she's not taking care of herself, those kind of symptoms that are anxiety related, sometimes getting fixated on specific things that may or may not be accurate. I think sometimes people will have like OCD type of symptoms, and it may come from a good place. Like you're wanting to make sure your baby is in a healthy home environment. So you want everybody to wash their hands and be cautious when they're holding the baby and things like that. But it can go to an extreme, and that's where you need to be able to recognize. And I think for the listeners, if you are a mom who's been affected or are currently being affected, being able to recognize what's going on is so important. And then if you are a loved one, your role is also important. And I think if I could give you any advice, I would say, don't take things personally when somebody is pregnant or postpartum. Like, really be compassionate and ask some questions, find out if there's more going on and what their needs might be. So depression, anxiety, sometimes OCD as a part of the anxiety. And then another category that we see more rarely, but is the thing that I think induces the most fear in people, is something called postpartum psychosis.
Okay.
And postpartum psychosis is when people are potentially having like that anxiety maybe goes to more of an extreme where they're having some paranoid delusions, or they're really not able to connect or bond to the baby. They may be disassociated from what's going on.
Right.
And again, that is a more rare, more like 1% of the people who are affected by mood disorders, but it can happen. And sometimes when I've seen it happen, it's really hard for the family members to understand and figure out what's going on. So if you're feeling like your partner is not really connecting with reality the way that you're seeing it, then it is more urgent to get help right away. And these are the cases where people may need, some temporary hospitalization or specific medications to help them recover from that experience.
Right. So you mentioned being hospitalized, and I think that's something that's super scary and a reason why people don't get help, even if it's not, that's rare. But I think even going to their doctor or midwife to say, hey, I think there's a problem happening here. The fear that you are going to be hospitalized or your baby is going to be taken away from you is a real thing out there.
Yeah, I totally agree. And I see that in practice often. People are afraid of being judged. And I think one of the things that motivates moms quite often is the feeling that they are going to be a good mom.
Right.
And so when they are dealing with some things that they can't really help, that they're having this response, but somehow in their mind, they're feeling like this means I'm not going to be a good mom, or I'm not capable of being a good mom. And we really have to work on, and that's why I'm so glad that we're here talking about this today, but we need to work on decreasing that stigma and letting people know that it's not uncommon, to have some mental health changes related to pregnancy. And why wouldn't it be? I mean, it's one of the biggest transitions, both for, moms and dads, really. It's a big transition to go from not having children to having children. You are grieving the time in your life the way it's always been, when you could take a nap whenever you want and you can do kind of what you want. Now you're kind of relying on needing to parent and the child's needs, is going to come first. So that's a big transition. And then I think socially, we used to have a lot more support for parents. We used to have grandparents and extended families. I know even in my generation, I had so many cousins and aunts and uncles. And I don't think my mom ever had to pay for childcare, but it's a totally different reality now for most people. And we have parents trying to do it all, literally. They're trying to work full-time careers and be good parents, and then take care of a household, prepare healthy foods. There's so many things that go into it. And it's no wonder, that people aren't, having a difficult time. But we need to sort of normalize getting help and recognizing that the support systems are not ideal in this country, and give people resources where we can. And I think the first step really is just addressing that stigma and letting people know it's okay to ask for help, both, in your family and in your friend groups, but also from your healthcare provider. And healthcare providers need to also be doing a better job at screening people. Sometimes they may just look at somebody and they have, maybe they earn good money, or they look put together when they come to the appointment, and they may not recognize that that person is suffering, from mood changes. So we need to be consistently screening everybody for mood disorders so that we can give them timely help.
Yeah. And I think a key thing that you said is that there could be something wrong, but it doesn't mean that they're a bad parent, because I think that is the biggest fear, is that you're a bad mom, you're a bad dad, or whatever. And that's not necessarily the case. And so getting the good help, or getting the help, shows that you are a really good parent.
Yeah.
Because you're taking care of yourself so you can take care of your child.
And I think one of the big things about being a parent that sometimes we miss is that our kids do what we do. And so if they see us over a period of time neglecting ourselves and neglecting our health, then they are going to grow up and do those things. So one of the best patterns that we could establish right from the beginning is recognize when we need help and get that help.
Okay, so what does that screening and getting a diagnosis, what does that look like?
Yeah. So, most clinics, OBGYN or midwife clinics do, and sometimes even pediatric clinics now are screening people for mood disorders postpartum.
Yeah.
I think we could do a better job of screening people in pregnancy. And I have a background as well in working with people with substance use disorder.
Yes.
And I think we also really need to be screening folks at the very beginning of pregnancy for substance use disorder so that they can get a timely intervention. Most people who have substance use disorder, or sometimes even people with pre-existing mental health problems, if we're not addressing that in early pregnancy, it may impact their engagement with prenatal care and ultimately their outcomes with the birth and potentially even long-term parenting.
Right. Okay. And I think one thing you had just said, so the screening early on, and my pediatrician, they did screen me. But I remember we didn't really do much. It was okay, good. Thank you for filling this out. And then that was it.
Yeah.
One thing that I think is beautiful about seeing a midwife is that you have a 2-week appointment. And I think that is critical, and that's not the case everywhere or with every office. And I think that was huge for me, is that I got to see someone at 2 weeks and then again at 6 weeks.
Yeah.
Do you want to talk on that at all?
Yeah, I would love to. So ideally, we would be seeing people much more frequently postpartum. Like I said, it's a big transition period. And I do think Kentucky has made some big efforts to improve postpartum care. We did pass an initiative to get postpartum care covered for the first year postpartum. So if somebody is dealing with a substance use disorder or a mental health disorder, we can as their obstetric provider, midwife, or OB physician could continue seeing them for follow-up. Again, we've already established a relationship with them. And it's not to say that they don't need other care. And in an ideal world, within these OB or midwife clinics, we would have access to social work and other resources, whether that's for substance use. In a clinic that I worked at, we had a specialized program that had a social worker and a provider that could prescribe medication and also peer support. So we could create really innovative models to keep people healthy and to keep them parenting with their kids. But it's not happening enough.
Right.
It's happening some.
Yeah.
And I think what you described as, being screened, but not really the follow-up that you needed. And that's kind of a risk, and why some of the providers aren't doing the screening is because they don't know what to do afterwards. If somebody does identify, that they have a problem, we need to have streamlined referral routes available.
Yeah. That's, I think, super important, because I think back to my pediatrician appointments, and I was like, well, what are you going to do with this? You guys can't do anything for me. But, so I think, do you want to talk about treatment options?
Yeah.
Let's talk about treatment options.
Yeah.
And then I think one of the most important, this episode, I feel like when you look at it on paper, it's kind of, you think it's for moms or moms to be or new, whatever. But really it's for the support people. Like that, I think is the biggest takeaway is that the support around the moms and the families is what's going to help the most. But let's talk about the treatment options available to moms.
Yeah. There are really good treatments. And I think there's also a lot of myths and misunderstandings around treatments. So what I can tell you, that whenever I'm identifying somebody with a mood disorder, whether it's during pregnancy or postpartum, the first thing that I like to do is to screen them for other medical conditions that could cause mental health changes. So 2 common ones that show up in pregnancy are thyroid disorders and iron deficiency. And if we are going to have a successful treatment plan, we want to rule those 2 things out first. Yeah. And then from there, I usually talk with patients about what their feelings are around interventions. Would they prefer like exploring therapy options and going the route of like a therapist, or would they like medication, or would they like both? What the research tells us is that both is often the most evidence-based and successful, treatment that we have available right now. There also are some innovative, like new treatments coming out, but I won't go into a lot of detail because I do think that's something that you should explore, with your provider. But sometimes people have strong feelings like, I don't want to go to a therapist, or I've had, my insurance doesn't cover a therapist, or it's too difficult to find somebody that I match with. Right. There's all those things. And then also on the other end, you'll see people who don't feel comfortable, taking medication while they're pregnant or while they're breastfeeding. And what I will say about that, and this is one of the links that we'll give you in the show notes, is there is a great resource called Mother to Baby that specifically looks at medications and how they interact with breastfeeding or pregnancy. And many medications are safe to take. And what we do know is that untreated depression or anxiety is not safe. Right. So when you're looking at the risk versus the benefit, that's what we need to think about. It's not like taking medication or not taking medication. It's like treating depression or anxiety versus not treating it. So you have to think that through a little bit, and it can be confusing. And I think particularly with anxiety, because sometimes what I see is the anxiety presents, like if you're talking about medication, then they can get really fixated on, the potential harm of the medication, and that might be part of their anxiety, but they don't even realize it. Yeah.
And they're not seeing the benefits that, outweigh everything else. And I like that you talk about looking at the whole picture before just jumping into a medicine and slapping it over a disorder, but looking at everything that's happening with the patient and then deciding the treatment plan. And that's part of the midwifery model is shared decision making, and the provider telling you what the evidence is and then helping you make a decision.
Yeah. And I also think there is, room to really look at your lifestyle, things like exercise and nutrition and certain targeted supplements can also help with mood, but it can be very overwhelming. I mean, I think, especially with depression in this case, the motivation to really make big changes or, like reaching out and finding resources when you feel this overwhelming depression, it can be very difficult. So I think really just having those conversations with a care provider who can help understand what's important to you and help you move from the place that you're in now to a healthier place.
Yeah. Okay. So finding support in your community and at home. let's start within the community. Where can you find it first? And how can community members be supportive?
Yeah, that's a great question. Like I was saying earlier, our communities don't look like they used to look. So we sometimes have to find our own communities as new parents. Sometimes there are like Facebook groups and it depending, like if you go to church, sometimes you can find mentors or people to support you in your church community. Sometimes if you have work friends or other people who've had kids before that you can connect with. But definitely the thing that I see within family dynamics sometimes is that when somebody is struggling with mood, it can be hard for, like saying earlier, for families not to take it personally.
Right.
And we really just have to move away from that and look at, like, when somebody is exhibiting some of these symptoms, how can we be helpful?
Yeah.
And sometimes the things that we think will be helpful won't be helpful to that person.
Yeah.
A really common thing is that family friends or in-laws may want to come over and take the baby for a few hours. But if somebody's having a lot of anxiety about the baby, then taking the baby is not going to solve the problem. And maybe that is what they need, but it's not going to work. And so maybe what would be helpful is if you came over and did their dishes or did their laundry or brought them meals for the week. So sometimes support looks different than the way you think. And so maybe asking what would be helpful versus just assuming that you know what's best. And people, family and support people, especially people with more lived experience, do have solutions and know how to help. But sometimes you can interfere with your ability to give the help if you're just making those assumptions that you know better.
Right. And not taking it personally and not playing the victim.
Yeah.
I think because then it makes the person who is struggling not want to ask for help whenever they're even ready to ask.
Yeah.
And I just jot down some notes because I had a baby, so he's 18 months old now. And within my community, I found, this is kind of weird, but like my lactation specialist, I mean, I was going to go to her because she became part of, like, that was kind of therapeutic for me. And that was really helpful. My physical therapist, like just those different places that I found community and help and just kind of not where you would expect it, but that's where I felt the most comfortable and the most, I would say, accepted. But then I also found there are so many like free new mom circles and new mom groups. And so I think that's really helpful, especially for having infants. I think once you kind of get past that 3-month mark, it kind of fizzles out because as a society, we kind of view that's postpartum, but really it's up to a year.
Yeah.
And so I think kind of looking where you least expect it and just kind of trying to find where you can find it. And I think for those people, just where I found it, they led with compassion and they listened and didn't offer unsolicited advice, but also knew when to say something and when to offer gentle help to me.
Yeah. I'm glad you brought up the unsolicited advice thing because I do think that is a source of stress for new parents, and it's a source of conflict sometimes. What I usually advise people to do, unsolicited, but is to really listen with your heart around the advice that you're getting. And if there are things that you feel, because you get to establish what your family is going to look like and the kind of family that you want to have, and it might look different than the childhood that you had growing up or what other people in your community feel like is normal. So I think if you get advice, listen to what feels good to you and feels right to you. And it's okay to pursue those things. But if you're getting advice that's causing you more anxiety and more stress or doesn't feel like it resonates with you, then you don't have any obligation to take that advice or to try it or anything. But I do think most people have good instincts and they just need to be supported in following those. And we're all different. So we're all going to do it a little different.
Right.
So there's not necessarily right or wrong, you know, paths, but there's going to be the path that's right for your family and for you. And it gets a little confusing when everybody's telling you to do something different.
Right. Right.
Or Facebook's
I was
telling you
going
to
to
do
say, and then
something
you have the
different.
internet and it's telling you a million things too.
Yeah.
Okay. So what about the support person within the house? So like your spouse or your partner. I feel like it's hard for them because they feed off of your energy and they're going through a huge life change as well.
Yeah.
So how can they be supportive? What can they look out for in that?
Well, I do think that partners are really instrumental in diagnosing, you know, mood disorders. And so I do think keeping an eye out, like, is my partner losing interest in things that they used to really care about? Are they feeling like down and depressed a lot of the time? Or, you know, on the anxiety spectrum, are they lashing out at me? Are they seeming unreasonable? You know, am I not wanting to come home from work because of this? So they are really key at helping identify when there's a problem. And I also feel like partners feel a lot of pressure to fix everything quite often, and recognizing that something that you can do is not try to do everything yourself, but you might be helpful in like finding other support people or calling to make appointments or those kind of things that might feel overwhelming to your partner. I know with my last baby, my husband changed all the nighttime diapers, and I didn't have that with my older kids, but it made a huge difference. And I wouldn't have expected it because I was breastfeeding and I was waking up to feed the baby anyway, but my baby was pooping every time. And just that little gesture of him picking up the baby, taking the baby and changing baby's diaper and bringing baby back, you know, that was a very simple thing that he did that made all the difference for me. Not always possible, you know, depending on people's work schedules and so forth, but there may be little things that you could do to give your partner more rest. And also, I think knowing what your partner normally does for self-care, like in pregnancy or before pregnancy, and reminding them of that. Like maybe it's they need a pedicure once a month, or maybe it's, you know, that they need some time alone, like to go for a walk or to take a long bath or something like that. But suggesting those things that they usually do for self-care, or giving them the space to make those things happen and the you know, to do that. Because a lot of times our needs will go on the back burner, you know, when we have a new baby, and over time that builds up, you know, and that's a key thing I think partners can do.
And I think to my husband, taking time for himself too, for the support person, for them to also, but I think still addressing what's at home, and if you know, call the mom's friend to come over so you can go and do whatever you need to do. To have that time away too is super important. And I know one thing that I was really lucky to have that isn't necessarily normal here in the U.S. is my husband had 4 weeks off with me, and that was incredible. And I still remember the day that he had to go back to the office because I was like, oh no. Okay. Anything else that you think we missed? I mean, there's so much that we could talk about.
Yeah, I think we could go on and talk about this all day. But I think we've got a good start with this topic, and we'll make sure and put some resources in the show notes for people so that they can find local help here in Kentucky. And then also there are some good platforms online that if people are struggling to find resources, they might be able to get them that way.
Yeah. Well, thank you so much for joining me and for sharing your expertise.
Yeah. Thank you for having me.
I know that this can be a heavy topic, but it's important we talk about it to help our families. We hope that this was informative for new moms and moms-to-be, as well for the people who support us. So grandparents, spouses, supervisors, neighbors, friends, and so on. Prioritizing your health and the health of those around us creates a happier and healthier overall community. We'll see you next time.